So I'm Zach DuBois. I am a board-certified family medicine physician practicing at Beacon Medical Group Center for Family Practice in Goshen, Indiana. So typical symptoms of perimenopause or menopause, we think about vasomotor symptoms, hot flashes, night sweats, brain fog, problems with sleep, low sex drive. Those are typically the symptoms that we're seeing, that we see women going through menopause or about to enter menopause. So typically this occurs over the course of 1 year, where women go from being fertile and able to conceive to not being able to conceive anymore, within being infertile. And so this is a sharp cliff that occurs over the course of a year. It's very abrupt, and it can cause lots of changes and create all of these symptoms. Hormone replacement therapy can be a good method for treating a lot of those symptoms. I'll talk about some of the symptoms that can be treated with hormone replacement therapy and the specific treatments for those symptoms. When I'm looking to start off a patient on hormone replacement therapy, there's really two options that we can do for women. There's either estrogen or progesterone. So I like to start with those things. For estrogen, the symptoms that are going to be most impacted by estrogen typically are the vasomotor symptoms like night sweats and hot flashes. So those can be improved with estrogen. Also brain fog and kind of the low sex drive and low energy levels are all going to be improved typically by administering estrogen first. If we're talking about more issues with your sleep, which can become very bothersome during menopause, I'm usually reaching for progesterone first for that, and then adding on the estrogen after that. And then if we've really dialed in the estrogen and progesterone and you're still having issues with fatigue and low libido and low sex drive, you can add on testosterone as well. So if you're considering going on hormone replacement therapy, is that if you still have a uterus and you haven't had a hysterectomy, you need the protection provided by progesterone to protect your endometrium and your uterus. So if you do end up on systemic estrogen through a patch or oral estrogen, you need to make sure that at least a couple weeks to months after starting on that estrogen that you are tacking on the progesterone as well, because that is protective for your endometrium and your uterus, and that will protect against unopposed estrogen, which can have an impact on your uterus and your endometrium and set you up for potential endometrial cancer. So one of the biggest things I think with hormone replacement therapy that's really low-lying fruit that almost every woman that's gone through menopause would benefit from is topical estrogen therapy for treatment of vaginal dryness, vaginal atrophy, so kind of the thinning of the skin of your vagina, and recurrent UTIs. By adding topical estrogen at a low dose, I think most women can see a great benefit to their vaginal health from that. You know, for your overall health and for your hormone health too, you really do need to focus on the foundations of your health, which are eating, moving, sleeping, and stress management. So for eating, your diet, you need to be eating whole foods, eat real food, meat, eggs, fruits, vegetables. If it has a box or barcode, you should avoid it. Drink water, black coffee, regular tea, avoid pop, even if it's diet pop. Exercise is also very important, so just moving your body throughout the day is great. Resistance training is very important, because especially as women get older and go through menopause and lose some of that estrogen benefit, which is really important for bone health. You can kind of offset that by doing resistance training, and the heavier the weight, the better. And then sleep is also very important for hormone health. 7.5 to 9 hours of sleep for adults is what we should be targeting, and make sure that it's good quality sleep and you don't have any issues with sleep apnea. And then managing your stress as well is very important, because high levels of cortisol can impact your hormones as well.